Hi, my name is Morgan Sykes, and I'm the spring 2015 intern at New Hanover Regional Medical Center in the Rehabilitation Hospital. So when I was looking for internships, I decided on New Hanover because I knew that I would get a lot of really good experience, and I also wanted to apply to physical therapy school. And at the rehab hospital, there's physical therapy, occupational therapy, speech therapy, and recreation therapy. Before the internship started, there was no interview or application process. Sarah Bentley is the supervisor, and she requires everyone who's an intern to volunteer here first so that they know what they're getting into, because it is really busy. It's kind of high volume patient load, and you just go all day. So Sarah does a good job of making sure that you're a good fit before you do start the 15 weeks full time. So New Hanover requires every volunteer to commit to 50 hours when they start volunteering. So I split my 50 hours between recreation therapy and physical therapy in the gym. So while I've been at New Hanover, I have learned a bunch of different things, not only about recreation therapy and how a recreation therapist works on a daily basis, but I've also learned a lot about working as a member of an interdisciplinary team. We do a lot of co-treatments with especially speech therapists and occupational therapists. We do some co-treatments with physical therapists too. So you have to really know how to talk to other people and ask them if they're willing to work with you with a certain patient, and you have to know how to exchange information between therapists in a professional way. I've also learned a lot about documentation. The hardest thing I think to learn was that there's no one set way to write goals, because in the rehab hospital all the patient care is individualized, which means it's patient-centered. So not every care plan you write has the same goals. They might be the same type of goals, but everybody is going to have a little different flavor to them. So that was a big thing that I learned. Another big thing that I learned here was planning for patients to go back into the community and how you do that. So the assessment process for the recreation therapy patients is a little bit different. It's 30 minutes, and there's no standardized tool that's used. The therapist or the intern will just sit down with the patient and get to know them and find out at what level were they functioning before. Were they independent in their home? Who, between them and their spouse or their family members, who did the cooking and the grocery shopping and things like that, and things that they enjoyed doing in their home and in the community, and at what level they were participating in those things, so that you can work with them to get them back to baseline or even better than they were before. So that's been a big thing that I've had to learn to do, is how to plan for the community. The things that I felt really well prepared for was, one thing was interacting with patients and building therapeutic relationships with them. And I think a lot of that came from all of my volunteer experience, because I had volunteer experience here and several other places. And it just really prepared me to work with them one-on-one and in small groups. Also building professional relationships with the other therapists that I was going to work with every day. Especially being a part of an interdisciplinary team, you work really closely with other people all day long. And some things that I thought I could have more preparation for were definitely the documentation and writing care plans. And like I mentioned before, no two goals are written the same way. And in school you kind of learn the cookie cutter way of every single goal is written the exact same way. But in the real world, it has to be measurable, and you have to know when your patient has reached that goal. And so that can be achieved in a lot of different ways. So New Hanover serves a very wide range of populations. New Hanover Regional Medical Center actually serves the whole southeastern region of North Carolina. The population of people ranges from, I think the youngest patient that New Hanover in the rehab hospital can have is in the teenager, adolescent age range, and the oldest patient I've seen was in their 90s.
So they serve a really wide range of patients and a lot of different diagnoses. Some of the most prevalent ones are stroke, brain injury, um, spinal cord injuries, neuro disorders, and uh, medically complicated patients. I've had 2 patients with Guillain-Barré since I've been here. I currently had a patient who has a spinal cord injury from a gunshot wound. I see a lot of different stroke patients. We have a lot of the patients from the brain injury unit, and those all range from car accidents. I've had one brain injury from a drug overdose. So you see a really wide range of people and diagnoses that come through the rehab hospital every day.
So the length of stay for patients in the rehab hospital varies a lot depending on their diagnosis, their discharge situation, and also the type of insurance they have, if they have any at all. So some patients may be here for a couple of days, a couple of weeks, and then some patients end up staying for as many as 2 or 3 months. So it really just depends on what they're being treated for and how fast they make their progress. Some of the brain injury patients, if they're younger, they tend to make progress a lot faster and they get to go home faster. The older the brain injury patients are, it sometimes takes a little longer for their recovery to progress as quickly. So it really just depends on what they're here for and also their discharge situation. Sometimes patients don't really have a discharge plan in place because there's no family or friends in the area to help them when they leave. And a lot of the times their insurance may depend on how long they get to stay, because the the case managers will have to work with the insurance companies a lot to get more time for patients if they feel that another week or a few days will make a really big difference in their recovery process. So the length of stay really just depends on the patient and what their current situation is, but 3 times a week we meet for what is called team conference, and a member from each discipline is present at the meeting, and it's led by the physician in the rehab hospital, and they discuss barriers to discharge, so any problems that the patients may have when they go home, and that determines also how much longer they need to stay. And a lot of times if the discharge date needs to be extended and that comes up in team conference, that's when the case managers will start to work with the insurance companies and present why the patient needs to be here longer. So the rehab hospital at New Hanover Regional is a 36-bed facility, and all the patients here receive at least 3 hours of therapy a day, and those 3 hours are counted for billable therapies such as occupational, physical, and speech therapy. There's only one recreation therapist here, and that's Sarah. So she will see anywhere from the lowest we've had our caseload while I've been here is maybe 6, but anytime it drops down that low, we always ask for orders on more patients that are appropriate, and we usually keep it at about 15 to 16 patients on the caseload. So the rehab hospital is 2 stories. On the first floor, there are a lot of the offices for administrative staff and therapists, and there's also the big rehabilitation gym, and that's where a lot of the patients come for their physical therapy and occupational therapy. There's also a kitchen. There's an ADL apartment where patients go to practice their activities of daily living. There's a kitchen. A lot of patients get treatments in the kitchen and the apartment as well, so that they can practice for when they get home. They might make a simple recipe or bake cookies or do something like that in the kitchen if it's something they'll be returning to when they're home. There is a car in the gym to practice car transfers for when people are approaching their discharge date. There is an area with sand, and it's like a little beach, so they can practice walking on a lot of different surfaces. There's a brick pathway on Easy Street that patients can practice walking on an uneven surface. That There's also a mini grocery store there, so they can go with a list of things and they can price check things, anything they would do in a regular grocery store once they leave. We also have a pool, and that's something that we've used a lot while I've been here this semester. So the second floor is all the patient rooms. There's 4 wings. Like I said, it's a 36-bed facility. There's a head injury unit, and that's a locked unit. It's a little quieter over there. The lights are a little dimmer, just to meet the needs of the patients who are suffering from the effects of a brain injury. Some of my duties and responsibilities as an intern at the rehab hospital consisted of keeping up with my caseload, attending team conference 3 times a week, team huddle every day, and an evidence-based practice group that meets weekly. So keeping up with my caseload consisted of me keeping track of all the patients on the rec therapy caseload that I was responsible for. So I would keep up with planning their treatments. I would kind of have an idea going into the treatment session of what we were going to do or what we were going to work on. Sometimes that doesn't always work because we do give the patients an option during their recreation therapy time to tell us what they want to do. If they tell us they don't want to do anything or they don't care what they do, then we get to step in and say, okay, well, it's a really good idea if we play Yahtzee today, because with us, you need to work on some fine motor skills, rolling the dice, picking them up, and in speech therapy, you're working on a lot of cognitive skills. So it's kind of fun to get to plan those different things. Another one of my responsibilities for keeping up with my caseload is I'm responsible for all the documentation that has to be done, and that includes every daily treatment note after we see them, the evaluation when I first meet them, progress notes and discharge summaries when they are ready to be discharged home, or if they're no longer appropriate for recreation therapy and we discharge them from our caseload. Some of my other responsibilities are attending team conference, which, as I said, is a meeting with one member from each discipline to discuss barriers to discharge for every patient that's in the rehab hospital and determine discharge dates. We go to team huddle every day, and that's a meeting for all staff, and we go over admissions, discharge, therapeutic passes. We do recognitions for people. We talk about how many days it's been since we've had a fall, Press Ganey survey scores. I also go to an evidence-based practice group every week, and it's a meeting with just students, and we present an article each week. It's really laid back and informal. You can research anything you're interested in, and you just come back to the group with your article each week and tell them what you found and just kind of summarize the article for them. Some of my most significant experiences in the internship have been, first of all, working with patients on the head injury unit. One of my very first patients was someone who just really touched my heart in a lot of different ways. He had suffered from an anoxic brain injury after he lost oxygen to his brain for an extended period of time. And he was also really close to my age, which was another significant experience. I've had several patients that have been really close to my own age, and you have to kind of learn how to process through that, especially when they've been through something really hard. It's a little easier to connect with them. My most memorable moment was probably when I had the patient who had suffered from an anoxic brain injury. If you asked him what he had for breakfast, he could not tell you. I mean, his short-term memory was just, they were really working on it in speech therapy and trying to get it back to where he was before the injury. And so every day he went over who he was, where he was, why he was there, the date, the month, the year, everything like that. And so I was doing a co-treatment with a speech therapist one day, and she asked him who all his therapists were, and he was able to name most of them, but he got some of the disciplines mixed up. And so she pointed to me and she said, "Who is this?" And he just looked at me and he was like, well, that's Morgan. And so I kind of thought, well, he probably just read my name tag, like he doesn't actually remember who I am because he can't tell us what he had for breakfast this morning. But I looked down and my name tag was flipped over, and that was probably that was pretty near the beginning of my internship. So that was when the light bulb went off in my head that I was like, okay, this is the setting that I'm supposed to be in. This is what I'm meant to do. And that was by far the most memorable moment that I've had here. As far as a special project, there isn't a special project exactly that you have to do while you're here, but every student is required to complete an in-service for all of this therapy staff. And it's just, you can pick it on anything you want to present to them. And I'm going to do mine in service in a couple of weeks on community reentry ideas right here on campus at New Hanover for therapists to utilize in their treatments every day. So that's all I have. It's been a really awesome experience here. I would definitely recommend this internship to anybody who's interested in this type of setting. I would definitely say check it out first and make sure it's for you, because you do have some tough situations that come through your door every day, and there are some days you have to go home and debrief yourself for a little while, but it's completely worth it, because if you love your patients and you love what you do, then you'll have an awesome 15 weeks.